Think about the last time that you intubated. How did you prepare? How did you get to the head of the bed? Where was your airway equipment? How were people positioned around the room? Now, look at these two intubations. One probably looks pretty familiar and safe. The other probably looks a bit riskier, maybe even outright dangerous. I'd like to tell you why I think the cliffside intubation is safer, more deliberate, and more likely to succeed. In EMS, one of the first things we teach new EMTs is the concept of a scene size-up. This is where you take in the entirety of the scene and make a plan for how you will approach the patient, provide care, and then extricate the patient and your team. In-hospital patients deserve a scene size-up as well, especially if you're about to take over their airway. The more stuff you put into a space, the less space you'll have to work. Less space to work leads to poor airway management. You need to take a moment to consider your space before you start instrumenting the airway. There are 4 main factors that will cause you to run out of space to do your job. Too much stuff, too many people, too much patient, and not having enough space to begin with. Even though a trauma bay might seem like a roomy environment when it's empty, we all know how cramped it can feel once you fill it with a patient and monitors and the code team and EMS and the ambulance stretcher and the Lucas and an attending breathing down your neck. The way you move through space and set yourself up in the room can dramatically increase your chances of getting that tube through the cords on the first pass. The best physician-led pre-hospital services in the world have first-pass success rates over 97% because they are serious about the way they approach space. Let's look at those 2 intubations again. This guy is wedged underneath a monitor. He can't stand up. He can't even extend his elbow. His colleague is boxing him out just to hold onto a C-collar. When I see this picture, I do not have high hopes for a grade 1 view. On the other hand, our pre-hospital team is on the side of a cliff, but they have taken full ownership of their space. They've set up 360 degrees of access to the patient. The intubator is alone at the patient's head. Her teammates are at the patient's sides. The monitor is positioned so that the intubator and her team can see it clearly. Her equipment is neatly organized in the yellow kit to her right. This team has taken ownership of the space in order to give themselves the best possible chance at first-pass success. Next time you have to manage an airway, whether you're in the trauma bay, the hallway, or the CT scanner, take a moment to consider your space. Do a scene size-up, position your patient, position yourself, position your equipment, and position your team. Own the space. Don't let the space own you.